there, welcome back to the Physiotherapy Clinical Edge. Hope you all like the new name of this page. And today I came up with a very interesting case study of shoulder pain of 35 years old female patient. I'm going to walk you through the assessment and how did I came up with the diagnosis, and I would really encourage you to put on your clinical reasoning skills and play along with me in this video. If this sounds great for you, let's quickly dive into the video. Firstly, let's look at the subjective history of our patient. The patient is 35 years old female presenting with 3 weeks of severe, really irritable right-sided shoulder pain. Now you can all imagine how much impact it has on the daily tasks that they do with their right hand. And one more significant thing that we have to notice here is the patient hasn't mentioned any history of trauma or any relevant injury that could possibly bring them such a bad shoulder pain. The only thing that they can remember is that the pain was all of a sudden in the middle of the night. You just woke up with sudden sharp pain at the shoulder. And also, at one point of time, the patient had to visit A&E and get the shoulder looked up by the doctors to know if anything serious is going on at the shoulder. But it was found that there was nothing serious going on at the shoulder, and it was treated with some analgesia to reduce their pain. And there is no significant past medical history that we should worry about, or no red flags, which is a good sign. And also the overall general health is good. Now let's look into their objective assessment. The pain pattern with this patient at their right shoulder is very clear, and every movement associated with that right shoulder is extremely limited due to pain or soreness at the joint. And even though there is no specific points of tenderness, or we can't feel any real tenderness on palpation, the patient really struggles or feels it really hard to do a little bit of movement at their shoulder. So with the range of motion, the patient had full active range of motion at the neck and the left shoulder, but it is extremely limited at the right shoulder, confined between 20 to 30 degrees due to pain. And no surprise, the passive range of motion was exactly the same. And even the simple resisted movements at the right shoulder made the shoulder more irritated and the patient felt more uncomfortable. Make sure that not to force the joint of your patient when they are in extreme pain. I hope now you have got a good amount of information about the patient with their subjective and objective histories. Now I'm gonna pause the video for a moment here and allow you to think and write down your thoughts before I'm gonna walk you through my approach. So friends, now let's walk through my approach, what I have done with this patient. So the fact that the patient presented this condition with a pain that is acute, sudden, and with no clear cause made me to think of something possibly like rheumatological. But the patient is too young, and with the presenting symptoms, it is more unlikely to be rheumatological. And secondly, no history of relevant trauma or injury made me to think of something serious like tumor. But when the patient is referred for investigations, the results was quite reassuring, and it really explained the patient's symptoms. And the patient's x-ray showed the signs of calcific tendonitis. If you can take a closer look at the x-ray of the patient, on the lateral aspect of their shoulder, there is calcium deposits, which is more commonly in the supraspinatus tendon and presents with the symptoms that the patient currently experiencing. Now let's take a look back at the patient's symptoms and match them to the calcific tendonitis signs. So the calcific tendonitis affects mostly the women than the men between the age groups 30 to 60s and presents with the signs of pain that is sudden and often disrupts the sleep by severe sharp pain. Whereas the frozen shoulder affects the people in their 50s with the pain and stiffness symptoms gradually developing over months. And there is no certain evidence in the patient's subjective history of any tendon overload or overuse or injury that suggests any rotator cuff tendon tear or lesions. With the management, it is always important to bear in mind about the patient pain levels. Suggesting physiotherapy may not be appropriate at this stage. A little movement at the shoulder for this patient could be way too sore for them, and it's always important to treat the patient pains at the first instance. And also we have seen the patient being to A&E and got some painkiller which didn't work well for them, and then the patient advised with some more available options that helps them better, like steroid injection when coupled with a painkiller works better in reducing their pain, and advised with one more additional procedure called barbitage therapy, where the calcium deposits will be broken down and could bring a really good result by improving their symptoms and reduces the pain and help them to get back onto the road, improve their range of motion. And finally, it's always important to make a shared decision by including your patient, by explaining them all available options, and by valuing their preferences and based on their needs. So always consider the treatment options in the best interest of the patients by valuing their decisions. So that's the end of the video. If you find it really informative and you have learned something out of this video, please like the video and follow for more such physio content.